information and awareness, which if you call us, and our phone number is in this copy of the presentation that you received, they can help you. Well, they will listen to what you or your family member may need and then connect you and refer you to other services in Santa Clara County. We also have a care management program, which is for people with low income and resources. We provide a social worker and nurse to help develop a plan of care and help implement that plan. We also have a senior employment program for people 55 and older looking to get back in the workforce. We help by subsidizing their income with the hope that the host agency picks them up. We also have one of the Meals on Wheels programs in the county. Our main Meals on Wheels program provides frozen meals for those who are unable to, who are homebound and unable to provide meals for themselves. With COVID, there are 2 additional Meals on Wheels programs, the Emergency Meals on Wheels, as well as the governor's program called the Great Plates Delivered program. But feel free to call us if you have any interest in Meals on Wheels. And then Stephen and I are with the Health Insurance Counseling and Advocacy Program, also known as HICAP. Now, HICAP is part of a national program called the State Health Insurance Assistance Program, as you can see. So every state has a SHIP, and each state gets to name its SHIP. California calls theirs HICAP. And we are primarily a volunteer-based program. So we train and register volunteers after over 30 hours of training and internship. They're registered with the Department of Aging and are here to provide free, unbiased, and objective Medicare counseling for Santa Clara County. So if you're interested in an appointment, feel free to call our number at 408-350-3200 and then option 2 to reach our department. Now, speaking of the annual enrollment period, it's October 15th through December 7th. And this is a period for anyone who's already in Medicare. Now, if there are folks who aren't yet in Medicare, at least you can learn what one might go through each year. But to exercise your AEP elections, of course, you need Medicare, either A or B or both. So what can somebody do? You can add, switch, or drop a Medicare Part D drug plan. You can add, switch, or drop what's called a Medicare Part C Advantage plan. And I'll explain what those are in a minute. But be aware that if you do drop Medicare Part C, that puts you back into what's called original Medicare, which you can use. But make sure that you have a way to handle the original Medicare out-of-pocket costs by either picking up and being approved for a Medigap plan, or that you have other supplemental coverage to help manage those out-of-pocket costs, which we'll look at. Now, every year around September, the plans will send you what's called an annual notice of change. It shows the side-by-side changes for the upcoming year. These are very important to help you understand what you can expect for next year and to help you decide whether it's still the right plan for you, whether it's a drug plan that works with original Medicare or a Medicare Part C Advantage plan. This is a document you'll want to find there. Either they send it to you or email it to you. If you can't find it, you can always go to the plan's website, or you can request it. So let's move on now to the parts of Medicare. Just a quick overview. What you see on your screen are on the left hand, what we call original Medicare, and on the right side, what we call Medicare Advantage. So let's focus first on the left side. When a person has Medicare, they have this red, white, and blue card, and you can see that it has Part A or Part B on it, or both. Part A covers people when they are admitted into the hospital. In other words, they're considered an inpatient, not an outpatient, not sitting in the ER waiting to be admitted. Part A kicks in once that formal admission has been ordered. Part A will cover somebody in a subsequent skilled nursing facility stay. Part A also covers home health care after such stays, as well as hospice care. Hospice being where one has 6 months left to live, and in which case you can elect hospice. All treatment for the underlying condition, however, will cease. It's more about pain management, counseling, and so forth. So that's what Part A covers. Part B covers outpatient services and all doctor services. Whether you're in the hospital or out of the hospital, Part B covers doctor services. It covers home health care, all the diagnostic tests, therapies, equipment and supplies. And with the advent of the Affordable Care Act, there's more of an emphasis on prevention. So an annual wellness visit was added to the Medicare benefits, and subsequent and preventive services no longer have copays for the most part. We called having A and B, just A and B, traditional or original Medicare, how it was back in 1965 when this started. You could take this red, white, and blue card, and you could go to any doctor, hospital, nursing facility, supplier in the country that was part of the Medicare program, and that original Medicare exists today. I'd say they're about, it's probably about 60% of the 60+ million people have original Medicare, whereas a growing number, 40%, are taking their Medicare and assigning it over to what's called the Medicare Advantage plan on the right, Part C. But back to original Medicare, there are out-of-pocket costs that must be paid by people in original Medicare. To handle those, a person usually has some type of supplement in the form of what's called a Medigap plan, which we'll talk about today, maybe a retiree plan, maybe Medi-Cal, to help pick up the out-of-pocket costs and maybe provide extra benefits to Part A and B. Also in 2006, outpatient prescription drug coverage was added to the Medicare program and can be had on the original Medicare side, but also on the Medicare Advantage side. So that is original Medicare. On the other hand, in the 1990s, Medicare Advantage was created and written into the law under Part C, and it describes the private way to receive the Medicare A and B benefits. And for the most part, in Santa Clara County, these are all Medicare-approved HMOs. This year, there is one PPO by Aetna, and the number of plans has grown year after year. I think when I first started, there were about 22 or 23 plans. Now we're up to 55 different types of plans, managed plans, I should say, in our county. Typically, they all include drug coverage. That's why down here it says Part B, D included. There is one plan that doesn't, though, and you need to get a separate drug plan with that plan. It's also a different type of Aetna plan. But I'll show you examples of these plans. Moving on to how much it costs to have Medicare. We don't yet know the 2021 premiums. Those should come out later in November. But as you can see, these are the 2020 premiums. And the starting base premium, these brackets haven't changed. So if your income, if you file individually, is less than $87,000 or less, there will be no adjustment to the base premium, which is $144.60 in 2020. But as your income goes up and you move into higher brackets, an adjustment is added, resulting in this premium here on the right per person. Okay. Now, I know some of you might be new to Medicare, about to retire. There are what are called life-changing events. So if somebody stops work or gets reduced hours, loses income through no fault of your own, Social Security will adjust this premium based on more recent information. So watch your letters and let them know if you move into a lower bracket based on a life-changing event. Okay. There are programs that help people pay the Part B premium. Programs such as Medi-Cal with no share of cost. So one has to have an income in 2020 below 12, around 1292 per month, and resources below a certain level, 2,000 if you're a single person. There are other programs called the QMB, SLMB, and the QI programs. These range in eligibility from 100 to 135% of the federal poverty line. These will pay the Part B premium. The QMB program is the one that's at 100%. Folks who have very, very low income could qualify for QMB and have the Part A premium paid for as well. There is also, with these programs, automatic enrollment into what's called the Part D Extra Help program to help with drug costs. Let's look now at Medigap plans. So Medigap plans are private insurance plans sold by private companies. They can, however, use health screening. They can ask medical questions and deny you if you answer affirmatively to some of their questions. But there are times where you're protected and you don't have to answer those questions. Usually when you start Medicare Part B, you've got 6 months to avoid having to answer questions, and enrollment is guaranteed. But there are a lot of other protected times that are triggered by certain events, which we'll talk about. There are, these plans are designed to cover your Part A and B out-of-pocket deductibles and copays, depending on the type of plan you pick up. So there are 10 standardized Medigap plans. They are A, B, D, G, K, L, M, and N. And there are also plans C and F. These plans C and F, however, are only available to people who were eligible or are eligible for Medicare prior to 2020. In order to get a Medigap, you need to have both Part A and Part B at the time of coverage. So this is a matrix showing what the Medigap plans cover. So along the left side, you can see the different out-of-pocket costs inherent in original Medicare. So, for example, a lot of people are familiar with Medicare Part B 20%. Medicare, it's called the Medicare Part B coinsurance right here. And if a plan, not to be mistaken with the part, if a plan has a dot underneath it, then it covers this, this expense for you, either fully or half of it or 3/4 of it. and there are some variations. The most comprehensive plan is the Plan F. If you can't get a Plan F because you're eligible for Medicare after 2020, then the G plan is the most comprehensive. You'll notice the difference between the F and the G is simply the Part B annual deductible. So these are the out-of-pocket expenses. Let me, I'm going to share a new slide with you. Let me show you this just to show you where we're at. So these are the two Medicare choices, using Original Medicare or using a Medicare Advantage plan. We're looking at Medigap plans. And although this chart shows you the out-of-pocket costs for Original Medicare. So here's Part A. And if you were an inpatient in the hospital, there's what's called a hospital deductible of $1,408. These are the 2020 numbers. Again, they haven't been updated for 2021 yet, but they'll be out soon. There's a copay after the deductible. Same with a nursing facility. Medicare covers the first 20 days, but the copay after 20 days is $176. So you can see the different out-of-pocket costs here. There's what's called an annual deductible for Part B, and after that's met, then you pay 20% of the approved amount. So here is a list of, here's that chart again. In your handouts, you'll notice you also have the list of insurance companies that sell these Medigaps, and they look at your age and your zip code, and they come up with a price. So you'll notice a variety of pricing. Our suggestion is, find the one that has the lowest cost to you, because they're standard. They will pay the same no matter which Plan G, for instance, you get. From one company to the next, it will pay the same benefit. So there's no need to pay a lot more. So for example, this one's $195, Continental Life, for someone at 65. Somebody down here, it might be $134. So again, no need to pay the higher amount. You'll get the same benefit from whichever plan you choose. So let me go back to the slideshow. Okay, so I've shown you some sample rates. You can also go for more specific rates onto the insurance.ca.gov website, and you could search for Medigap rates or supplement rates, and enter your zip code and your age, and you can get a little more accurate sample. But really, in the end, if you're interested, you should talk to the insurance company to get a quote for you. All right, let's move on to Medicare Part D. Again, with Part D, you'll get an annual notice of change in September. Take a look at it. The most important thing is to know whether your list of medications will be covered for 2021. If not, you could be paying out of pocket for the full price for medication. So we encourage people to always check each year to make sure they're still in the right plan. This year, we have over 30 prescription drug plans that work with Original Medicare. You can also get Part D through Medicare Advantage plans. If you're in one, of course, you probably have drug coverage through them. To have Medicare Advantage, you must have both A and B as well. You don't need a drug plan if you have other creditable drug coverage, which means as good as, it pays out as good as Medicare or better. Some examples might be veterans drug coverage, or maybe a retiree plan coverage. So no need to get that if you have creditable coverage. Now, when this first started, Medicare created what's called a standard benefit design that insurance companies would design their plans off of. So here's an example of here's the benefit design for 2021. And what you see here are 4 columns that represent the different phases that you go through as you fill your prescriptions through the calendar year. The first period is called the deductible period. So a deductible, by definition, means that you're going to pay the full price until the deductible is met. Some plans have deductibles and some don't. But once you meet the deductible, or if you don't have one, you're going to start paying the initial coverage period copays set by the plan. And I'll show you some examples, but you stay and pay those copays until you hit this number, $41.30. And that number is basically the full cost of the medications, what you pay and what the plan pays. When that hits $41.30, then you move into what's called the donut hole, or the coverage gap, technically, at which point you're going to pay 25% of the cost of the drug. In 2006, when this whole started, you were having to pay 100% of the cost of the drug. But with the Affordable Care Act, that's shrunk, and it's now mimicking the actuarial amount of 25% in the initial coverage period. So they're considering the donut hole closed now at this point. But of course, you still have to pay 25%. Some plans might charge a little less for generic drugs in that period. Now, once what's called your true out-of-pocket cost reaches $6,550 next year, then you move out of the coverage gap and into the catastrophic period, and you're going to pay a significantly lower amount through the end of the year. Now, this $6,550, just to clarify, it's a different number than $41.30. $6,550 is what's called your true out-of-pocket cost. So whatever you've paid during the deductible period, what you've paid during the initial coverage period, what you've paid during the coverage gap gets added together. But you can also, they will also add in the 70% of the cost of brand name drugs to your true out-of-pocket cost. So that will help you get out of the donut hole faster. So add it up. Once you hit $6,550, you're going to pay 5%, or $370 for generic, $920 for brand, whichever is greater. Now, premiums have the average premiums gone down. The lowest one is $720. The highest premium, Part D premium, is $134.30. Nationally, again, the average has gone down. It was 35 in our area. Now it's 33. Actually, nationally, and the deductibles range from 0 to $445. The Part D, similar to Part B, has an adjustment based on those same brackets. Again, they haven't come out yet, so we'll be updating this when we get the new information. There's also assistance for drugs. It's called the Low-Income Subsidy or Extra Help Program. It can lower your Part D premium. It can lower the copays at the pharmacy. We don't have the 21 figures yet. All these numbers come out at different times. But to give you an example of 2020, when someone's income is $1,595 or less, with an assets of less than $13,000, not including a house or a car, then you might qualify. Again, people get this automatically if they have Medi-Cal or a Medicare savings program. Now, we encourage people to sign up for what's called a mymedicare.gov account. You could go to medicare.gov, as this slide shows, and log in or create an account. By doing that, you can then have access to the list of medications that you've filled throughout the year. For those that use a lot of medications, this is really helpful because it's pre-populated in what's called the Plan Finder tool, which if you click the button, Find 2021 Health Plans, you can log in through there, and it will help you analyze your list of drugs against the 2021 plans. So I encourage everybody to sign up for a mymedicare.gov account. You can also see on this web page other helpful buttons that you can press. You can learn a little bit about Medicare. You can find care, like you can find providers and facilities. That's a really neat tool, which I'll talk about later. And check and see what might be covered or not. And then, of course, another way to get to what's called the Medicare Plan Finder to analyze your list of drugs and which plan would work best. So I have a list of the different plans that I'd like to show you that we've put together. So here's the Part D plans, and you should have received that. But what you can see here is the standalone drug plans. On the left are is the insurance company, and then sometimes they have 3 plans, sometimes they have 2 or just 1 plan. This shows you the monthly premium, and then whether it has a deductible or not, which can range from 0 up to $445. After the deductible period, then you move into the initial coverage period. And depending on the type of medication you have, if it's a tier 1, tier 2, tier 3, these are the copays that you would pay. Sometimes they're 0 if it's generic, as high as 5, but most of them are 0 or 1 or $2. The tier 2 is maybe what's called a non-preferred generic. And you can see that the pricing can vary up to $10, $19 it looks like, depending on the plan. And then brand name drugs are usually put into tiers 3 and 4. And here you're seeing percentages or higher copays and so forth. And then, of course, once you reach that $4,000 plus, then you move into the coverage gap, at which point you're generally paying 25% of the cost of the generic or brand name drug. Most plans have mail order. This column indicates plans for people with that extra help drug program. Sometimes folks who qualify for this and get extra help automatically are automatically put into what's called a benchmark plan. So that's what these gray plans are. They're benchmark plans for people with extra help. And then this last column is the star rating of the plan. As you can see, it's on a 5-star basis. They go up to there are no 5-star plans, but they do go up to 4.5 in some instances. Okay. But again, the tool to help analyze this is what's called the Medicare Plan Finder tool. So we can help folks do that. You can try it yourself. We can walk you through it. But this will resort the plans based on your list of drugs, the pharmacies that you pick, and then it will spit that out based on your estimated annual drug cost for 2021. Okay, so let me go back to the presentation. And okay, so let's talk about Medicare Advantage plans now. Again, Part C is another way to say it. It's a capitated system. That means that Medicare Advantage plans, they receive a certain amount of money from Medicare per member per month. So capita means per head in Latin, I believe. And they use that money in addition to the premium that you pay to provide the A and B benefits. So some key changes in 2021 with respect to Medicare Advantage plans. One of the biggest is the fact that they can now accept people with end-stage renal disease. Before, you couldn't have end-stage renal disease and enroll into a new plan. In 2021, that's now possible. In 2020, hospice benefits were under Part A, and being in Part A, that meant you could go to any hospice agency you wanted. If you're in a Medicare Advantage plan and it offers hospice, then you would use the MA network for the hospice services. Also, Medicare Advantage plans that provide what are called Part B medications. These are medications that need to be administered either through a durable medical equipment device, like a nebulizer, or you have to be administered at a doctor's office. These can be expensive medications. And CMS is allowing Medicare Advantage plans to implement what's called step therapy. Step therapy means that you must try less expensive medication before they will approve the more expensive medication. So sort of taking a step-by-step approach that is now allowed for Medicare Advantage plans. Now, the other big change that we're seeing in Medicare Advantage plans that continues in 2021 is the addition of extra chronic condition benefits. So in other words, there are extra benefits that Medicare Advantage plans provide that Part A and B don't. For example, A and B do not cover routine vision or hearing or routine chiropractor or acupuncture. These can often be provided by the Medicare Advantage plan. Traditionally, Medicare Advantage plans could offer extra benefits that were health-related in nature. But going forward, they have more leeway and can provide benefits that are not primarily health-related. So things that we think of in terms of long-term care services, like services to help with activities of daily living. So for example, Medicare Advantage plans can offer maybe adult day health services, in-home services, caregiver support, home modifications. So we don't have a comprehensive list of these. On the Medicare.gov website, it might indicate that there is something, but do not expect that you will get it necessarily. It's still up to the plan. The plan has to look at your case and then approve it or not. So it's on a case-by-case basis, these extra chronic condition benefits. So you have to have sort of a chronic condition as well, as determined by the plan. Okay, so let's look again at annual enrollment period. More specifically, dropping Part C Medicare Advantage. And we talk about this because often people want to know, can I go back and forth in between original Medicare on the left side or Medicare Advantage on the right and vice versa. It's very easy to go from original Medicare to a Medicare Advantage plan. You simply enroll and there are no qualifying conditions in terms of health, and it starts in 2021. Going the other way from Medicare Advantage back to original Medicare, It's easy, but there's risk that needs to be handled, the out-of-pocket cost. So that's why we warn folks, if you want to go from Medicare Advantage back to original Medicare, make sure that you're approved for a Medigap before you make the switch. Otherwise, you're exposed. Fortunately, there are some protections that you should know about. In the insurance code, there's what's called a guaranteed issue right that you have to get a Medigap, no questions asked. But it's triggered if you're in a Medicare Advantage plan and your Medicare Advantage plan increases premiums or cost sharing or takes away a benefit or reduces a benefit, then you get this right. It depends on if your Medicare Advantage plan sells a Medigap or not. If, for example, your Medicare Advantage plan is through, say, United Healthcare, Aetna, Anthem, Blue Shield, these folks sell Medigaps as well. If there's any kind of increase, then you get the opportunity to purchase one of their Medigap plans. If a company doesn't also sell a Medigap, such as Scan, Alignment, Stanford, Kaiser, then the bar's a little higher. They have to have increased their premium by 15 or cost sharing by 15% or more, or dropped a benefit. Then you can go into any Medigap with any company. However, it's best to do this during the annual enrollment period, because you can't get a Medigap if you are still enrolled in a Medicare Advantage plan. So you have to drop the Medicare Advantage plan at this time and then show that you've done that, and then sign up for the Medigap plan that you want. If you need help with that, feel free to let us know. So just a reminder then to check your Medicare Advantage annual notice of change to see if something did in fact change and trigger an opportunity for you to go back to original Medicare with the protection of, say, a Medigap plan. And we've looked at a number of those plans, and there are a handful that have made such a change, affording their members a Medigap guaranteed issue right. So we will be putting out that information, but again, you can always look at your own Medicare Advantage plan to figure that out. Now, some additional updates in 2021 that are common to both Medicare Advantage and original Medicare. First, there is medically approved non-opioid pain management to help address the opioid epidemic. Whether you're in an original Medicare or Medicare Advantage, there is that benefit now. There's also what's called a senior savings model. Basically, plans can offer these low-cost insulin, $35 per month for insulin, but you have to be certain that the plan that's participating in the senior savings model covers your specific insulin. You know, not all insulin is the same. Not all plans offer the same type of insulin. But regardless, the way we do our drug analyses is insulin may just be one medication. So although you may be paying $35 a month, don't forget about the other medication in your list, because you want to look at it as a whole and find the plan that gives you the best savings and access to your list of medications. There's also, you know, with COVID, actually expanded telehealth even now. In other words, prior to COVID, telehealth was limited to rural areas. Now, folks in urban settings like ours can make use of telehealth services, you know, of course, to try to keep people safe at home. And they've increased the types of services that Medicare will cover for telehealth. If you're in a Medicare Advantage plan, you can go out of network, but you want to talk to your plan first before you do that. But that is available to folks who can't get the help they need in say, a current Medicare Advantage network. Again, the Find Care tool is mentioned here. You see these similar icons. So if you go to Medicare.gov, Find Care is a really nice tool to help you find nursing homes, hospitals, suppliers, providers that are in the Medicare program. So I encourage you to take a look at that after you sign up for your MyMedicare.gov account. So again, other resources, Medicare.gov, CMS.gov. This is the administrator of Medicare. If you're kind of a wonk and want to know the criteria that one must meet for coverage of certain services, NeridianMedicare.com, jurisdiction for California. You can find a lot of information there. And then Levanta is Medicare's quality improvement organization. Now this, they offer different services. Like let's say you feel like you're being discharged too early from the hospital or nursing home, you can contact them and they can evaluate the case and see if the discharge is appropriate. Also, they have what's called immediate advocacy. It's a service that can they can jump in and help resolve open healthcare concerns with your provider. Maybe you feel like the quality of care you're getting isn't good, or you're having difficulty getting what you need. You can ask Levanta for immediate advocacy, and because they work with Medicare, they try to help open some doors. So last word is to keep an eye out for fraud and abuse in Medicare. Fortunately, they've turned a light onto this, recouping billions of dollars. I get emails about different scams and schemes being prosecuted. So I ask you all to guard your Medicare card. Even though it no longer has your Social Security number on it, you can they can still grab your card number and bill Medicare for services that you haven't received yet. Now, this not only jeopardizes the trust, the Medicare fund, but it could impact your access to whatever fraudulent claims were put in those services. So, if you look at your statements for accuracy and something just doesn't seem right, then you can let us know and we'll move it to the proper authorities. But some common things we're seeing: free genetic testing. If it's too good to be true or too simple, it's probably not. They're trying to get your Medicare number. There was a Medicare card sort of touted. $200 is what I think was said in the news, and already fraudsters are jumping on that, calling folks and saying, to get your $200, you need to give us your Medicare number. Well, it's not even in existence yet, that program, if it will be even. But beware of that. Medicare will not call you. Social Security will not call you. So do not give that information unless you generated that call. There's also, COVID-19 testing scams. It's free in Medicare, the COVID test. So, so go through your provider or, a certified testing center. Okay. So with that said, again, our contact information, if you'd like to sit down or rather talk to, we aren't doing face-to-face, of course, at this time, talk to and schedule an appointment with one of our HICAP counselors. You can visit our website at mysourcewise.com or call us at these numbers here. If you're in another county, you can call this 800 number and you'll be routed to the HICAP in that particular county. Sometimes we get folks from Santa Cruz or Mountain View. That's the number you'd want to call. So with that said, I'd just like to thank you very much, and hopefully we can entertain some questions this time.
Right, thank you, Marcelo, again for all the information. Lots of good material. Even though I knew the material you were going to be presenting today, I still find stuff that didn't quite gel. So thank you again. I'm glad I can participate. And like you were saying, so all right, everybody. So now is a good time to either, if you have any questions, feel free to ask in the chat feature or the chat tool below, the Q&A tool. We could also unmute your microphone and you can voice your question yourself. So feel free, it's open forum. Again, I know it's a lot of information that was covered today. And so one of the questions we have is how difficult is it to change levels of a Medigap plan? Excellent question. In other words, I think what you may be saying is if I want to change from a Medigap plan A to maybe a more richer Medigap plan that will pay more, how do we change that? Ah, perfect. Yeah. Okay.
So let me show the this Medigap chart here.
That's a great question, by the way.
So yeah, so you can change, just so you know, you can, if you have a Medigap, you can change Medigap plans at any time. You can go from a plan of fewer benefits, like in this example, a plan A has the fewest benefits. If you want to go up to a plan G, you can do that anytime, but you would have to answer medical questions. Now, I would say that if you don't want to answer medical questions and you have a Medigap and you're trying to go from an A upwards to a higher benefit, the time to do that in California anyways is during your birthday and 60 days thereafter. We call it the California birthday rule, where you can switch plans, switch companies to a plan of equal or fewer benefits with no questions asked. So, so the protection is only if you go to a plan of equal or fewer benefits. Going up is difficult unless you're healthy. What we have heard from, and this isn't a plug, but we haven't heard from any other company, but United Healthcare tells folks that if you're a Medigap member with United Healthcare, AARP, you can go up without underwriting, without any questions. I haven't seen it in writing, but I haven't heard any complaints. So that's the only plan that will let you do it without underwriting, as far as we know. Okay.
Thank you, Marcelo. I think that was good explanation, and the AARP specific mention was very valuable to the one who asked the question. So thank you. Mm-hmm. So great question, and yeah, and just a friendly reminder to everybody who joined here, we did email out to all the registered participants the slideshow that Marcelo was going over, the Medigap that we're looking at right now, and the detailed numbers. You know, the nice fancy chart was all emailed. The Part D drug information was emailed, and all those various links that were shown to you above. Those should all be live and active links in your slideshow that we sent along too. So you can actually click along and use those links. A high level overview of the differences now, Marcelo showing this. One big concept for folks to be able to understand is, you know, the original Medicare model, which is a Medicare Parts A and B. More often than not, it's partnered or accompanied with a Medigap and then a Part D drug plan. So that's one model versus the Medicare Advantage model, which I don't know, maybe we can call it a one-stop shop type of business. That insert, and once you're able to differentiate the two and how those benefits are handled and administered, especially some of the costs that are associated with those two models, I think that's one of the bigger challenges. But most folks who are in this meeting today are probably, well, should be our existing Medicare beneficiaries. But you know, that's a good point to grasp and understand, and then you can kind of figure out, okay, well, what do I want to do? How do I want to handle my Medicare benefits? And this chart above that we're looking at was also emailed out to everybody too. And now again is a good time. I know we still have a lot of folks in here joining. I think it's very valuable when folks ask questions, and for all that are here to hear the answers, because maybe we didn't realize that that's a question we had ourselves. So please feel free to keep them on coming in. If you don't or can't think of any questions now, I would really encourage you, give us a call if you do have any questions on the materials covered in the presentation. Materials that were emailed out to you, our contact information should be on all of those materials that were emailed, but please give us a call at 408-350-3200, option number 2 to get a hold of HICAP. And we'll be glad to sit down with you if you have a unique situation. Well, everybody's Medicare benefits is unique. Everybody has their own needs. We'll be glad to sit down with you and schedule a one-on-one. Of course, it's going to be a free and objective counseling session. We'll be glad to do that with you, especially during the annual enrollment period, which is right now. I'm glad you're all here early. We have until December 7th to make some decisions on our Medicare benefits if we want to make some changes. So again, if there's any questions, please feel free to shout out in chat, in the Q&A. Otherwise, we'll go ahead and wrap up this meeting. And again, the number to get a hold of HICAP, I'll go ahead and enter it in the chat too. 3200 option 2. Yes, please take down our telephone number. You could always visit us on our website, mysourcewise.com. We have some frequently asked questions that are there regarding to Medicare topics in the HICAP section. Like Marcelo was talking about earlier, we do have a lot of in-house other services that we offer, and HICAP topics and business is also on our main website, mysourcewise.com, 408-350-3200, option number 2 for HICAP. If we don't answer, which by the way, we are receiving really high call volume right now, but don't be discouraged. Leave us a voicemail. We're going to call you back and we're going to answer your questions in that callback. Or if it's appropriate, we're definitely going to make you a one-on-one appointment with one of our certified counselors to make sure we take care of all of your questions and help. And right. Without that, thank you again, Amanda, everybody at Cupertino Senior Center. We appreciate the partnership. And everybody who joined here today, we appreciate the patience. I know we had a little bit of a bumpy start, so thanks for bearing with us. I hope you found some value in this presentation. I'm certain you found some nugget of info that you didn't know and you can take action on. And we are here to help in any Medicare topic. So please reach out if you need to. We are here. And other than that, we'll go ahead and close the session. Thank you, everybody, and have a wonderful week.
Thank you, Stephen. Thank you, everybody.
Yes, sir.
Take care.